Good afternoon, everyone. Dr. Morrison will provide our daily update in a moment. I just wanted to join today to make one announcement and also to be here to answer some questions that many may have following the release of our in-depth plan yesterday. So to begin, Executive Council has approved the extension of the current state of emergency to May 31st, 2020. This was an original order instituted by the Minister of Justice and Public Safety on April 16th, and that original order was scheduled to expire at midnight tonight. As you know, this is a measure that we put in place to allow us to better contain the points of entry to our province, to provide more resources to the Chief Public Health Office, and operations have been working very well and will need to continue for the foreseeable future. Every case of COVID that we have had in this province has been travel related, and we know that remains one of our vulnerabilities as a province. So we need to continue to be very vigilant with our screening process. A big part of our comfort level to begin easing back on May 1st is built around the continuation of safety measures, such as allowing for only essential travel, ensuring those entering our province are aware of the procedures we need them to follow, such as self-isolation for 14 days, and that we will be following up with them daily to ensure the procedures are being followed. We have also increased our capacity to test significantly, especially a new testing site at the Confederation Bridge, and we have continually expanded our testing criteria to test more people and testing more often those essential workers interacting with our most vulnerable populations. I also want to say to Islanders today an important message, and I want to make sure this gets through. I know Dr. Morrison and also Marion have been bringing this up daily, but to all Islanders out there, if you are sick and you need medical attention, we want you to seek treatment. Our hospitals are prepared to deal with COVID-19 and also to treat those who need it. The health, safety, and well-being of Islanders at this time is not limited to COVID-19. So do not be hesitant if you need health care. It is there for you if you need it, and we encourage you to get it. Also, the plan that we released yesterday, which will begin with Phase 1 on Friday, has provided some hope to many Islanders, and we believe it has placed some important goalposts for our province as we begin the long, slow road back. To date, Islanders, all of us, we have had to make painful and disruptive adjustments to our lives. I wish I could tell you that that will end on May 1st, but that wouldn't be the truth. What we outlined yesterday was a framework. Now we have to work to fill in the boxes to begin to define the new normal in each of these phases as we deal with the real-life situations and implications with each of these phases. But it's really, really important for Islanders to remember that we are not returning to normal. We are beginning a road back in a worldwide health pandemic that has changed the very way we live, work, and operate. The way we have operated in the past will not be the way we operate for the foreseeable future. The way we have visited our parents and grandparents will be different. We can't greet people with a hug or a kiss or a handshake. The way we play sports, if we're able to play them, will not be the same as they have been in other years. The way businesses and restaurants serve their customers will not be the same. We all want this to be as short a time frame as possible, but for now, for the foreseeable future, this is our reality, and we need to find a way to work within it to get through this together. When we announced our plan yesterday, we were very open in saying that we knew it wasn't perfect, that we knew it would be needed to be reviewed regularly, and that we will try to respond to issues as they arise. As Islanders, we have all done well, and we need to continue to do well. I am very proud and impressed with Islanders, with how they have come together to address these issues head-on, and we've done so with energy, with optimism, with togetherness, and that approach needs to continue. Our plan, as we indicated yesterday, errs on the side of health and public safety. We need Islanders to exercise that same judgment with the same caution as we begin this road back. And I know this is very hard. It's horrible for all of us. It's been a tremendous, tremendous change in all of our lives. We have made significant sacrifices. Myself, I have 3 brothers and 4 sisters, dozens of nieces and nephews, and I'm very fortunate that we are a very, very close family. And it pains me that we can't get together right now to have a bonfire and have some laughs like we have done for so many years. But I remain hopeful that that is on the horizon, and I hope it's soon. I hope that the efforts that we have all taken by following the health directives and measures will get us there soon. But we need to continue this work. We need to stay on this path, to stay on this trajectory, knowing that we have done well, but much, much more work remains. So over to you, Dr. Morrison.
Thank you, Premier. And I think, as always, you've captured so many of the important messages that we're trying to get to Islanders. Today, I just want to, in terms of our update, now mention that there are over 3 million cases of COVID-19, and that number continues to increase, and there are over 218,000 deaths. And in Canada, we are now over 50,000 cases, half of those being in Quebec, and more than 2,800 deaths. We have, as of yesterday, 27 positive confirmed COVID-19 cases, and as the Premier mentioned, all are travel-related. It remains crucial to our efforts to contain and mitigate COVID-19 and the spread of COVID-19 in our province regarding our ability to test. And it's critical for our ability to move forward as we ease up public health measures. And so the testing continues to be important. So if you have symptoms, please call 811 or get referred by your family physician or nurse practitioner for testing. We've also broadened the testing, and we've talked about that different times here as well, and looked at broadening for providers as well as some essential workers at the bridge. We also are having a meeting later on today to have even more discussions about broadening that testing and where we can do so. In terms of the self-isolation and Operation Self-Isolation, yesterday, as of today, actually, there are 2,087 individuals who are in self-isolation in Prince Edward Island, and that includes 590 essential workers. And to note, 1,253 people have completed their period of self-isolation, and that's since we have started that program of calling people daily to make sure they are self-isolating, but also to offer supports during that period of time. So yesterday, as the Premier mentioned, we announced the Renew P.E.I. Together plan. It's a plan to ease public health restrictions related to COVID-19, and it is a phased approach starting on Friday, May the 1st. And we will continuously look at each phase and how we're doing. It is a process for all of us to go through. So we're asking to please work with us. Please work with us over the next few weeks as we go through these phases. We have also worked so hard, and we recognize we've all worked hard together already and have done so well. So let's continue to do so. And no plan or policies are perfect. But we are trying to help all of us. We're trying to help you. We're trying to help our province to reopen as safely as possible. And as someone in my office said this morning, if someone's not sure, we should go with the lower number. And we have to use an approach where it's safe for everyone. We need to remember we are in a pandemic and to use the best judgment we can based on what we know about the virus and also what we don't know about the virus. To support businesses, industries, and sectors in their efforts to get ready, and not only in phase 1 but throughout the phases, we are going to be releasing general overarching guidance that may help. We're also putting out guidance, for instance, on campgrounds. And so those are anticipated in the next few days. So these guidelines, along with other resources for sectors and islanders alike, will be shared on the Renew P.E.I. Together webpage over not only the next days, but the weeks ahead. These will also on the website include some updates. So we listed some examples, for instance, of outdoor activities, but not all outdoor activities were listed. So, for instance, horseback riding wasn't specifically mentioned, but that absolutely is included in Phase 1, and it will be reflected and updated on the website. And we mentioned a number of other areas, but in terms of providers, psychologists, for instance, also in Phase 1, and these will be updated as we go forward. I also want to clarify that businesses, really right from throughout COVID-19, many businesses were operating virtually and providing delivery or curbside pickup with appropriate public health measures in place, and they can still continue to do so. As the Premier mentioned, this is a plan. It's an approach to help us all. It's to help minimize illness and death in a pandemic, but at the same time try to get us moving both physically, socially, economically as we go forward. And there's certain basic public health measures that will need to continue throughout. And they are the ones we talk about all the time: the hand washing, the physical distancing, staying at home when ill, and the enhanced cleaning. And to also echo the Premier, my colleagues and friends in the emergency rooms and in different parts of the system really have emphasized, please do not hesitate to come for treatment or care in our system. On May the 1st, and we've had a lot of questions about this, of course, it's about outdoor gatherings of no more than 5 people will be permitted with physical distancing. So Phase 1 is not about indoor gatherings with people who live in different households. And some examples could be 5 friends from different households sitting on a deck together, or a family of 3 visiting their aunt and uncle in their yard, or 2 children stopping by to visit other friends in their driveway. The gatherings must be outdoors with 5 people with the physical distancing. And I appreciate for large families this is difficult, and for our family included. And I think I mentioned yesterday about the recreational activities, and also there'll be further guidance about the recreational fishing and golf courses. I was asked to re-echo from yesterday that select outdoor and construction services such as landscaping, road construction, and indoor construction projects with a maximum of 5 people in the facility at one time, watershed cleanup and outdoor photography will be allowed with proper physical distancing practices in place. And new construction that follows the project guidelines can move forward. And although we're speaking about easing back on some of these restrictions, it's important to note that some things will stay in place for the foreseeable future. And we all hope that is not too long. But border screening will continue at points of entry, and all persons entering the province will be required to self-isolate for 14 days. And visitor restrictions in long-term care facilities will be maintained, as well as priority public services and home-based learning options, and there'll be further details on that from education. We've all made many adjustments throughout the COVID-19 pandemic and will continue to adjust as we go. The plan is named Renew P.E.I. Together because it is going to take all of us working together to do this right. And let's keep working together to protect yourself, protect others. And we've been, so amazed by the kindness that people have shown each other and their patience, and their caring for each other. And I ask that we continue to do that in the weeks ahead. And we'll need each other's support as we take these steps forward. Thank you. OK, en français. Je vais juste faire quelques minutes. À travers le monde, le nombre de cas a dépassé 3,1 millions de cas et plus de 218 000 morts. Et au Canada, plus de 50 000 cas et plus de 2 800 morts. Ici, à l'île du Prince-Édouard, il y a 27 cas positifs et 24 sont rétablis. Et hier, je vous ai annoncé le plan de renouveler l'île du Prince-Édouard ensemble et notre plan provincial pour le déconfinement. Et la mise en marche du plan sera en plusieurs phases pour les entreprises, pour les services et les espaces publics. Et à n'importe quel moment, s'il y a des inquiétudes, nous pourrions ralentir, arrêter ou même retourner aux mesures plus sévères pour la protection de notre province. Et c'est dès vendredi, nous commencerons à relâcher certaines mesures. Une des choses on commence sur la première étape. On va commencer à réintégrer plus de services de santé. Et cette planification est un travail de concert entre Santé de l'île du Prince-Édouard, les leaders provinciaux, mon bureau et les experts médicaux. Ceci sera en plusieurs étapes. Les priorités seront identifiées et la réintégration des services petit à petit nous permettra d'avoir un équilibre entre plus de services médicaux et la capacité de gérer nos besoins à la COVID-19. Vendredi, les rassemblements dehors sont limités à 5 personnes et à distance physique est nécessaire. Il n'y aura pas de rassemblement à l'intérieur. Et voici quelques exemples. 5 amis se rassemblent en groupe, une famille de 3 pour visiter une autre famille avec 2, et 2 enfants peuvent visiter leur tante et leur oncle. Et ça doit être dehors, et encore, je vous répète que c'est un maximum de 5 personnes. Et certains projets de construction, la photographie extérieure et l'aménagement de paysages seront permis tant que la distance physique est respectée. On a beaucoup changé notre façon de vivre et on va devoir continuer à faire ça. On a donné le nom à notre plan provincial de renouveler l'île du Prince-Édouard ensemble parce que ça sera un effort collectif pour le faire comme il se doit. Et étape par étape, on va y arriver. Ça va bien aller. Merci.
Thank you very much, Heather. We will now take some questions from our friends in the media.
Nicole Williams, CBC.
Hello to you both. My question could be for Dr. Morrison or Premier King. Both of you reminding people to please go to the doctor if they need treatment. And we know that Marian Dowling has been sort of repeating this message over and over again herself. I'm wondering, has something specific sparked this? Has anyone died or gotten seriously ill because they were too scared to seek treatment?
Hi, Nicole. I think it's just been a really important message that we've continued to deliver at various times through this pandemic. And so it's not anything particular that was brought to my attention, but just in general, we want to make sure that people don't delay treatment or care if they're having symptoms they're worried about, and because I don't want people to be worried that they could get COVID-19. I know Marian has said that different times, but sometimes if different people are saying it, we can hear it differently. So it's something that we just continue to say as we move into these different phases.
Thank you for clarifying that. And then my next question is, we know you mentioned that the schools won't be coming back on May 11th, but is it safe to say that class learning in schools will not be happening before September?
Essentially would be yes. I think that the education department would be looking at some options of what they could do on a limited basis, or as I said yesterday, perhaps a by appointment process with a parent and a student with one of the teachers or something like that. They are exploring some very minor type options, but I think it's very safe to say that school as we know it for this term will not go back to what it was prior to the March break.
Thank you.
Thank you.
Louise Martin, CBC.
Hello. Thank you for doing this. So I'm going to ask, I think, Dr. Morrison this one. This is more about the capacity rules in daycares, Dr. Morrison, come May 22nd. What kind of capacity are you looking at? How many daycare spots will be available for each daycare, and how will it be decided exactly, which kids get back into that daycare?
So, Louise, I know that Minister Trivers may be the one who can speak later to some of the details, but we have worked certainly with early childhood in some of the guidance around the emergency childcare spots for essential workers, and in many ways that guidance will be very similar. So limiting numbers, how to do the enhanced cleaning, and limiting numbers in both licensed and unlicensed. I know that there will be further discussions with early childhood about what the details around that plan, but it would be similar in terms of the number of staff and students in those centers, and they've talked about how you screen children and screen staff, and those kind of enhanced thinking, really, not only in early childhood, but some of those same things being having to be considered for all aspects of our business and our service industries. So, but there'll definitely be more details
on that. If I could just add, Louise, that I think obviously some of the challenges we face there would be around, space, would be around capacity. I think there's probably a realization that with schools not going in, that we have now an added capacity needed for childcare and those types of things. So, I mean, from a space requirement, I know they would be looking at whether we could make some schools available if we're not using them to actually provide some space. We also have a challenge with the number of educators. So it's really the time right now to roll up our sleeves and to try to be as creative as we can to try to tackle these challenges that 8 weeks ago we never thought maybe we'd need to tackle.
Interesting. I was wondering about the schools for space. Okay, so my other question today is about dentistry. And I know it's not in part of the early phases, and of course no one will argue that healthy teeth are essential to someone's health, but on the other hand, it is perhaps one of the highest probability of getting droplets in the air. So do you have any sense of the plan for resumption of dental services on P.E.I.?
So, hi, Louise. I did have conversation with the Dental Association and the College of Dentistry, and they are certainly finalizing a plan, but their indication was in phase 2 they would be able to do certain emergency certain emergencies cases in their office, and then slowly going out to the next phase, some urgent cases in their office, and then continuing on from there. So they had already had lots of discussion and looking at their national bodies as well to what that would look like. And so the language around the dentistry certainly reflects the fact that a lot of their procedures would carry certain risks related to aerosolizing generating procedures, so they also needing some time to make sure that their offices are set up in particular ways for the safety of patients and the staff and the dentists and personal protective equipment being part of that.
Okay, thank you so much.
Thank you.
Sean McDougall, Eastern Graphic.
Good afternoon, everyone. Dr. Morrison, I was just wondering if you could expand a bit on what testing is going to look like in the coming weeks and months as we reduce restrictions. I know you've said that there's going to be a testing station at the Confederation Bridge, and you're expanding other parts of testing. I was just wondering if you could just elaborate a bit more on that and whether or not it's going to include folks who are asymptomatic.
Yes, so we've spoken quite a bit about testing, I know, in the last number of weeks, and really we have probably, at this point in time, one of the broadest categories for testing, I would say, in the country, certainly one of the broadest. We are already have expanded to include testing of some asymptomatic people, including people admitted to long-term care facilities, and we're as of last week, healthcare workers who might be moving between long-term care facilities. As you mentioned, having set up at the Confederation Bridge to identify anyone. We're screening people to find out if they're symptomatic at the bridge, of course, so we would be testing people who have symptoms, but also identifying international travelers who may be returning and testing them whether or not they have symptoms. And also some of our, for instance, long-haul truck drivers who may be down in the United States or elsewhere, and then being able to test them, and again, not waiting for anyone to have symptoms, but to test them when they get back to Prince Edward Island at the bridge. So already having done the expansion, and of course, in terms of asymptomatic people, also testing asymptomatic close contacts of a case, and we have had that in place for a while. So we will continue with that. We'll look at other groups of people, and it will be based on risk and what we know about the epidemiology of COVID-19 here in Prince Edward Island, and trying to protect the population, residents of facilities and staff. The other group of people that I didn't mention were healthcare providers who are, for instance, living in another province and who are coming here to work. Again, not waiting till they have symptoms, but trying to test them on a regular basis as well, every time they come. So we'll continue to have that discussion, and I'm so pleased we're in a position to be able to talk about broadening our testing criteria here.
Okay. Now, with regards to the newest case of the virus, I was wondering if you could talk a little bit more about the patient, how their health is doing, what county they're from. Do you have any idea of where they may have caught the virus? So,
and may have gotten buried in all the different information from yesterday. So the case is a gentleman in his 50s who, and it's related to international travel. And in the follow-up, he actually flew into the Halifax airport and then drove across the bridge. He is residing in Kings County. And he's at home and doing well, and he has been self-isolating since arrival in P.E.I.
Okay. Thank you.
Okay.
Jim Day, The Guardian.
Yes, good afternoon to you both. For Dr. Morrison, what would constitute an outbreak sufficient enough to end the loosening of restrictions that are going to be imposed in phase one of the ease back?
So we've talked about that as well. Hi, Jim. In terms of what are criteria that would cause us to raise more concern, and we've talked about where if we were to see, outbreak in a long-term care facility, and an outbreak in a long-term care facility would actually be considered one case, and then we would look at if there's widespread community transmission, and it would, again, sometimes it would depend on the situation, but we'd learn more about the case, where they could have acquired the virus or not. And even if we had, a number of cases that related to international travel that we felt we didn't have the capacity to do good contact tracing on, and because they had a large number of contacts that we were concerned about. So there are a variety of things that we'd be looking at. So not only the number of cases, but our capacity to do contact tracing in those situations, and also the capacity of the health system to respond to a large number or increase in cases. So it's a number of those factors.
Okay. I was hoping to pose this question to Marion Dowling, but I'll put it to you or the Premier. There's been a fair bit of concern raised lately that limitations on hospital services has added a great deal of pressure on Islanders requiring home care, that as more and more Islanders access health care at home, the ability of the system to respond appears strained. Can you describe the strain that's being experienced in home care and what's being done to address that situation?
So, Jim, you're right. It's probably Marion would have been better positioned to answer that. I thought she did address it a little bit yesterday in one of her, or 2 days ago in her comments. So I'm not sure I can speak specifically to that. I can say that as part of this phase one, there's making sure that the health system is looking at a phased-in, prioritizing approach to non-urgent health care services, and I think that is all part of it. So there'll be a group of people, certainly from Health P.E.I. and the department and physician leaders, who are going to be really looking at what the transition looks like through that phased approach to bringing in more medical services on board. So I think that's linked to your question. And there'll be certainly more information that Health P.E.I. is working on as well.
Thank you.
Okay.
Teresa Wright, Canadian Press.
Hi there. My questions are for Dr. Morrison. I'm asking. I'd like if you could expand on what you were saying in terms of talking about broadening testing. Specifically, will that include non-essential workers as people start to go back to work? And also, will you be distributing personal protective equipment to businesses? And if so, are you concerned about shortages?
Hello. The question around the broadening of testing, so we are meeting on a weekly basis to review the groups of people for testing. So it is, and of course those testing groups may differ in different provinces and territories depending on the COVID-19 situation. So we will be continuously reviewing what groups might be tested. I think I listed a number of those groups already, and so we'll be considering certainly other essential workers if we need to. I think one of our focus has been, because our cases have been related to travel outside the province and outside the country, wanting to identify groups that may have travel and are having to go back and forth and maybe going into situations that put themselves and others at risk. So those would probably be some of our next priority groups in terms of the testing. In terms of the personal protective equipment, I think that is a broader question, and we certainly are. I guess it depends on the businesses and the organization. We have a provincial repository for where supplies are being brought into in the province for personal protective equipment, and there have been requests from firefighters, for instance, and other, not just the health system, but outside the health system for personal protective equipment. And then there's a table that determines how that gets distributed. And I think there's quite a range of types of personal protective equipment, and we talk about masks, the N95 mask versus surgical masks versus the non-medical masks. I don't, and I mean, there'd be someone else who'd probably be able to speak to what would be provided to businesses. I think we would be giving guidance, and then based on the request, it would be determined whether or not personal protective equipment would be required. So that's an ongoing discussion for sure.
Thank you. And also, could you just talk about when you were coming up with this plan, what were some of the unique considerations that you had to make when thinking about lifting restrictions in PEI that might be different than plans that we might see in other provinces?
Well, I mean, probably the biggest one that is unique for PEI is that we have limited points of entry and into the province, and based on the spread of the virus here, one of our biggest risks is the importation of the virus. So we certainly the plan for easing up restrictions here is fairly uniquely based on the fact that we can control their points of entry, and that we also keep things that we have been doing that have been going well in terms of our following up people who for 14 days after they arrive here, and phone calls, that being really important. So making sure that those restrictions stayed in place as we go forward. I think one of the other sort of, I'm not sure if it's too unique, but we as one of the earlier provinces, I know some of the provinces have gone out with plans, but we'd certainly be one of the earlier ones, asking people to actually take some responsibility and keep a log of their contacts, and that will also assist us in terms of some contact tracing, and I think people will do that going forward as well.
Carrie Wynn McLeod, Ocean 100.
Good afternoon to you both. My questions are for Dr. Morrison. Just still with the PPE efforts that are being made. I've noticed, and I've seen many others, or heard from many others rather, about the PPE requirements specifically at the QEH, that they seem to have been relaxed, and not all staff that is giving care are wearing masks anymore. I'm just wondering why that would be, and is it a supply issue?
Hi, Carrie Wynn. So I think, and I don't want to speak for every facility, but I think in general the approach has been around masks is making sure people consider point-of-care risk assessments. And so I think there's some of that going on in terms of what masks and where they should use them. My understanding was that direct patient care, that healthcare workers were wearing masks in most places when they were providing direct patient care. And that was certainly my understanding. Again, Marion would be probably the better person to give you an update about the exact supply issue at the hospital, but certainly they have masks and there are more masks being brought in, and that whole supply of PPE is being coordinated for not only Health P.E.I. but for other parts of the system as well, and I know there's big efforts being made to try to coordinate that going forward.
Okay, thanks. And also with this latest case that is in Kings County and the international travel, you mentioned about tracing earlier as well, and I'm just wondering, did this gentleman travel with a number of other people? Obviously, probably on that plane, but in coming to P.E.I., was he in contact with many people there? And if so, how's that being handled? Are they all being tested? And when you say that he is self-isolating at home, is that like in a communal spot, like a hotel, or what's happening there?
So, Carrie, just like any of our other cases, any close contacts, including anyone that he would have been in a car with, for instance, that needs to be tested, would be tested. But the process is the same for all of the cases in terms of the really good contact tracing that our public health nurses do. And I am not going to discuss any further details of exactly which house they live in for obvious reasons.
Thank you.
Okay.
Laurent Rigaud, La Voix acadienne.
Bonjour, Dr Morrison. J'ai une question. Je pense que vous y avez répondu en anglais. Quels sont les critères qui vont déterminer si on passe d'une phase à l'autre phase? Le 22 mai, s'il y a un nouveau cas, 2 nouveaux cas ou 3 nouveaux cas, est-ce qu'on passera à la phase 2? Comment vous allez décider exactement?
Bonjour Laurent. On regarde vraiment c'est pas seulement le nombre de cas, mais si c'est on a beaucoup de cas avec la transmission communautaire. On regarde s'il y en a assez de capacité avec les infirmières de santé publique pour faire chercher les contacts. On regarde aussi la capacité de système santé pour prendre soin des gens si on a plusieurs personnes avec COVID-19. Et ça va dépendre un peu de la situation. Si ce sont les personnes qui ont voyagé et n'ont pas auto-isolé, et puis on a beaucoup de contacts, c'est un peu plus... on est plus inquiet à propos de cette sorte de situation. Alors, on a toutes vraiment de sortes de choses qu'on va regarder, mais c'est le nombre c'est pas seulement le nombre, mais on va regarder la situation en total.
Okay. Et dans les recommandations qui sont mises sur le site Internet du gouvernement, il est écrit que les gens doivent garder comme un journal de leurs contacts. Je crois qu'en anglais, c'est Personal Contact Log. Est-ce que vous pouvez nous expliquer ce que c'est en français? Qu'est-ce que vous attendez de la part des insulaires sur ce point-là?
C'est vraiment une façon qu'on n'oublie pas qu'on a fait une visite avec quelqu'un et puis une autre visite avec quelqu'un. Et puis, si vous devenez malade et vous à COVID-19, on peut regarder, vous pouvez nous aider par dire, oui, en 2 jours passés, j'ai vu 3 personnes, c'est les personnes. Alors, on peut vraiment assez vite chercher les contacts qu'on doit pour faire les tests et pour être certains aussi vont auto-isoler.
Merci.
Okay. Thank you.
François-Pierre Dufault, Radio-Canada.
Good afternoon to you both. My first question would be for yourself, Premier. Given the plan that's before us now, do you know, or have you given any consideration into which phase would a hypothetical spring sitting of the legislature fall into? And have you given consideration to maybe holding it in another location than the Coles building, maybe an unused high school gymnasium that will allow for social distancing between MLAs and clerical staff?
Well, thank you very much, Francois. Actually, the leader of the opposition and the leader of the third party and I had a conversation yesterday with the Speaker and the clerk of the legislature to try to come up with a date to have at least at the beginning maybe a one-day session toward the middle to the third week of May. We are looking right now at the clerk of the legislature has gotten out his measuring tape, and if we were to remove the media gallery and the public gallery in the current Coles building, that they can adequately house 27 members safely. That plan is still yet to be signed off upon by the Chief Public Health Officer as of yet. But so we are looking at going to get some of our at least a preliminary budget dealt with, to look at whatever the expenditures would need to be for the go forward, to review what we've spent on COVID, and to get some legislation passed that we need to get passed. Some of those that the opposition have been talking about around the Employment Standards Act, around evictions, things like that. We also need to get 3 positions ratified by 2/3 vote of the legislature: Child and Youth Advocate, the Auditor General, and there's one more, the Privacy Commissioner, I believe, or the Ethics Commissioner. So there is some business to do, and so right now we're working on a one-day type session. As you know, Francois, I've been wanting to try to do this with 27 members, because it is hard to tell someone who's been elected to the legislature that they can't sit. But I think the clerk and the Speaker's office will need to talk now to Dr. Morrison. But the House leaders will continue to meet and try to figure out what a day could look like. So I think to answer your question, we'll have a session for a day, and then probably later on, sometime in the summer, a bigger, a more broad session, but all subject to the official sign-off from the Chief Public Health Officer.
Thank you, Premier. Prochaine question pour Dr. Morrison en français, si possible. Pour ce qui est des écoles, on l'a abordé un peu en anglais, mais si je comprends bien, les écoles ne rouvriront pas leurs portes pour les classes normales pour le reste de l'année scolaire. C'est bien ça? Oui, exactement. Les classes comme on avait avant la congé de mars ne seraient pas comme ça. Et ne commence pas encore, mais je pense que le département d'éducation est en train de s'organiser. Si peut-être il peut avoir quelques enfants si ils ont besoin, mais ils sont en train de travailler sur les détails. Merci beaucoup.
Merci.
Well, all right. Well, thank you very much, everybody. I really do appreciate the efforts of the media as always, and everyone out there, stay safe. So thank you very much.